Welcome to Digital Garden State, a podcast by the New Jersey Health Information Management Systems Society.
Welcome to the New Jersey Health Information Management Systems Society podcast series, where we discuss emerging trends in healthcare technology and their impact on our industry. New Jersey HIMSS is a consortium of healthcare professionals, providers, and vendors who are committed to promoting constant improvement in the use of information technology within the healthcare industry. I'm your host, Mike Fortino, current New Jersey HIMSS board member and account executive with Galaxy Solutions. Today's podcast episode starts our customer story series. Our chapter is supported by some amazing companies, and without their sponsorship, we could not deliver on our mission of healthcare technology advocacy and learning. Today, we're going to be speaking with two great guests from Zebra Technologies and MedStar Health. MedStar provides comprehensive healthcare services across Maryland, Virginia, and Washington, D.C. And here representing those organizations is Ricky Jennings, Chief Nursing Informatics Officer at Zebra Technologies, and Christina Russell, Assistant Vice President, Telecommunication Services for MedStar Health. Ricky, Christina, thanks for joining, and could you both tell our audience a little bit about yourselves and your organizations? Ricky, would you go first, please?
Sure, Mike. Thanks for the opportunity to join you here today. I'm Ricky Jennings. I'm a registered nurse by background, and as you mentioned, I serve as the Chief Nursing Informatics Officer for Zebra's North America Healthcare team. I, alongside our entire organization, work with our customers and our partners in the healthcare space as they adopt new technologies. At Zebra, we're focused on connecting people and data across organizations, particularly focused on the front lines and critical assets of business.
Great. Christina.
Hi, all. Christina Russell. As Mike mentioned, I'm the Assistant Vice President for Telecommunications at MedStar Health. I've been working in healthcare IT for almost 20 years. I've been at MedStar for 13, working on various teams with our electronic medical record as well as some of our infrastructure teams. MedStar is a healthcare system in the, Mike mentioned, the Maryland, D.C., Virginia area. We have about 10 hospitals and about 150 outpatient locations that we service as part of our IT team.
Wow, that's a large organization, especially, 10 hospitals is quite large, and then you add into those 150 ambulatory locations, and that can be daunting to do any type of technology project. Speaking of which, we did have a quick conversation a few weeks ago about this great customer story. Christina, could you give us a little bit of background on this? Because I'm really not that familiar with the inner workings of a lot of the hospital organizations, but I think, what we're going to talk about is a nurse call system integration effort. If you can just kind of give us a little overview on the background, and we can dive in from there.
Sure, absolutely. So as I mentioned, we have 10 hospitals at MedStar Health. We are growth by acquisition, as many healthcare systems are. We are at a point where we have had some aging technology, both on those devices that do barcode med administration as well as our wireless phones. So we are at a point where we need to start replacing those technologies. Now, the nurses carry two devices around, one for voice and one for scanning capabilities. So we took to a point of deciding we wanted to have what we call a converged clinical device. We're now moving to a single device that has a number of functionalities, one of those being barcode med administration. We also are implementing clinical communication, so that really includes voice, secure messaging, alerting, so nurse call alerting, as you mentioned. And then we're looking at some additional applications, but those are our core set of applications. So we did a little road show with our nursing teams about 4 years ago, and we took a few devices out to the nursing teams and let them touch and feel and look at what they were and give us some input. And we landed on the Zebra TC series of devices. So we're in the process of implementing those. We have implemented those at 3 hospitals and 7 more to go. But we're using two models of those devices, one that has the barcode scanner, and then one that does not. So folks that don't need to do barcode scanning, there's a slimline device, if you will, that we're utilizing, but gives them the same touch and feel from an application standpoint.
Gotcha. Wow. There's a lot there. Could you kind of back up a little bit towards, when you mentioned the roadshow, and getting to a roadshow, that means that you went about a due diligence, you did some evaluations and wound up selecting Zebra Technologies, right? So can you kind of talk a little bit about that process and, when did Zebra Technologies really come into focus or,
so we did some validation on the IT side first, right? So we wanted to make sure the devices that we were taking on the roadshow actually worked with our applications, that they passed the IT test first. And we had narrowed it down to 2 devices, 2 manufacturers, Zebra being one of those. So we did our, like I said, IT testing, and then took that to the roadshow. And Zebra, has been part of that process, I think, from the point of us doing road shows, right? So we reached out and said, can we get a couple of demo devices so that we can take these out? We actually got them set up where the nurses actually did a survey on the device. So they went to a website and did their survey of the 2 different devices. So we actually, made them use them, even if just to submit a survey that we could collect data on. So they were definitely part of the process from IT testing throughout.
Gotcha. Ricky, could you kind of talk a little bit about that whole process, up front? I know that, a lot of companies, organizations, they say, gee, I want to do a proof of concept. I really want to make sure that once I do my due diligence, as Christina mentioned, right, did that IT test, what's it like for you, to kind of put something like that together to kind of make sure that things are aligning?
I think what Christina represented and how they made election of their technology solutions is really not uncommon from most organizations these days. And as a clinician myself, I see it as really positive. Increasingly, the partnership between IT and clinical end users has become tighter, and more so clinicians are really getting to be at the helm of that decision making. And I think really what better, as you're looking at and going to your question of having a successful proof of concept, you need to have the buy-in from the end users who do this work day in and day out and understand where their pain points are today and where their needs are. So the approach that MedStar took in putting the clinical voice at the front of selection and design is absolutely the route to success, and from a very positive standpoint, one the industry is seeing more often.
Gotcha. Well, what about, Christina, from, the whole approach, right? I guess there's got to be some science to that, right? If you can kind of talk a little bit about, what that was like. When you're how thoughtful you were around, that IT test, right? The selection, and kind of how did you move the project forward from there?
Yeah, so after we did our IT validation, obviously made sure they were certified devices from our electronic medical record vendor, which is Cerner. So we, made sure that was happening. I would say from an IT standpoint, we were comfortable with either device that we put out in front of the nurses. But we were really looking, as Ricky said, for their feedback on how they were going to utilize the device. I would say as we started down the implementation strategy, so once we selected a device, I think the importance of nursing and clinical involvement becomes more and more important. And you really have to have those teams on board. I will say that even through COVID, we had our team's involvement, which was great. So we have a really good nursing informatics program here and a really good provider informatics program. So they were definitely involved not only during device selection, but then involved during kind of application build out and design and getting the devices prepped for testing.
Once you had that first successful set of tests and, you moved towards the first real implementation, can you talk a little bit about that and what it was like to, a little bit of, I guess, about the teams that were involved, in order to make all that happen?
Yeah, so it was a number of teams. It takes a village, right, to implement an IT solution. So, like I said, we had nursing informatics, we had provider informatics, we had the actual clinical teams that are on the floor seeing patients. So we had nurse managers and champions, if you will, from our nursing teams. We have Cerner involved as our EHR vendor. We have our own application teams here at MedStar Health, so they were involved the entire way. And then the teams that I work for is the infrastructure team, and there were infrastructure team members available looking at device configuration settings, looking at network settings, wireless settings. So there were a number of teams involved, and we're still making tweaks and adjustments to both the application and the network and the wireless and the devices. So those teams continue to be involved as we're looking to future rollouts and how can we really kind of optimize. But it certainly takes involvement from all those teams, and it takes them all working together really closely to get to a successful implementation. And, I won't lie and say everything's perfect here at MedStar Health. We're certainly, like I said, still tweaking things along the way.
It's never perfect anywhere.
Right. So those teams are all still actively involved, even at the sites that we did implement so far.
Well, that's a great sign. If all the teams are still actively participating, I mean, a great sign that yes, this is working. Now let's optimize, right? Let's move it further. That just speaks to a great solution, right? If you don't mind, there's a strategy. I guess I mentioned before this. I like to say there's science behind things, but strategy around your first implementation. Was there any criteria that you had in the back of your mind, when you wanted to go to that first hospital?
Yeah, so there were a lot of criteria that went into, kind of picking who goes first. Some of it had to do with, what's going on at that particular hospital. So what other projects do they have going on? There was also, a discussion of, what's the current state of their current devices? And are they rapidly, breaking and dying? And do we need to replace them? So that was, some of the criteria that went into it. Criteria just around which hospital is a little more flexible when it comes to IT. So I think we all would probably agree that some facilities are a little more IT savvy than others. So, and we know that at MedStar Health, which ones, are more flexible when it comes to that, or, what their size is. It's obviously sometimes easier to go to a smaller hospital than a 1,000-bed hospital. So there's a lot of criteria that went into it. We have changed the order many times, and we're still changing the order for the 7 that we have to go. So we go back and forth. COVID played a big part in what we were doing. So we did do some implementations throughout the pandemic. So that also played into, which hospitals are busy with COVID and which are not. Lots of criteria that goes into kind of, which hospital goes first and which goes last. And sometimes you just have to pull the Band-Aid off and pick the biggest and loudest one and go with it.
Yeah, it sounds like, very complex, right? Just the infrastructure side alone, as you mentioned before, with the tweaking, the different settings, that's daunting. And then on top of that, you add, the different applications that you have to deal with. Ricky, I guess, Zebra Technologies has got a device or a set of devices that really offer great flexibility. Can you talk a little bit about that?
Well, I think Christina made great mention of the science and it taking a village. And I think the complexity of the team that Christina talked about being involved is representative of the complexities of the workflows that these technologies support. There really is no standalone technology in any of the critical workflows, particularly in patient care delivery. And when you have not only from our perspective, we're always looking at it from just what's in our portfolio, but our portfolio is a part of an ecosystem that supports multiple partners and multiple different use cases. So as we're working with our customers and they have these dense teams with rigorous strategies and workflows that they're looking to address, you really do need to get to that workflow by workflow situation where you're mapping through steps and users and then pairing the technologies, be that hardware, software, a multitude of vendor ecosystems, to be able to make sure that from end to end, you can look at a process, or we talk about workflows in healthcare, in a situation where an end user doesn't face disruption, that each step occurs exactly as it's anticipated every single time, because that's where the elements of patient safety become most critical. And it's why it's highly reliant on large teams with multiple vantage points to be successful.
That's, so true how it is a, the level of engagement. You always think that up front, level of engagement is high, everyone's excited, you have that first implementation. It does take a lot of, I guess, I don't know what the word is, but, a lot of determination to carry that through, right? Because you've got multiple hospitals to go, other locations to consider as well. But it leads me to kind of think about governance, right? So there's governance when you set it up, and then there's governance when you want to continue on. Can you either of you talk a little bit about that and how that plays out or is playing out right now?
Yeah, I mean, we've set up a mobile device governance committee as a result of implementing these devices, because you get to a point where you're working on an Android operating system, and there's a gazillion apps out there, and the minute you put a smart device in somebody's hands, they start thinking about all the other things it can do. So
like solitaire and things like that. It's what I do.
Right, exactly. So we've locked that down. They can't play solitaire. But we have, implemented a few things that are what I'll say easy wins. So, the nursing team they wanted a timer app, so they can set a timer on when they need to go back and, check on things. So we, implemented something as simple as a timer app for them to be able to have that functionality, so they weren't having to use their personal cell phones or their Apple Watch. So we put that all on one device. But there's certainly you get to a point where if you don't have governance around those devices, then it comes with a little bit of a free-for-all, and you get too many applications on, and then the purpose of the device diminishes. So we have a pretty tight governance structure where we take requests for new applications. It goes through a round of interviewing, if you will, from a team of people that represent kind of device and application stuff. And then if it passes that team, it'll go up to our IT leadership team for review. But it certainly needs governance, not only from an app, but as much as I want to change how loud the device is. So we've had that conversation from a governance perspective. Yeah. Like some people, would like to have the device, turn the whole way down and only vibrate, which in some instances just isn't practical, because the purpose is that you hear the alerts. So there's, a lot of conversation that goes into it, and you really have to hear the clinical teams out on, these what we may think of as simple items that really aren't simple when it comes to a clinical setting.
I imagine that, as you are doing your rollout, you're making new friends, right? Everyone really likes a successful rollout, wants to be part of that. Can you talk a little bit about, is there the demand, I guess?
Yeah, I mean, when we first started this project, we were really thinking it was our nursing teams. When we got into the project, we realized because our scope of the project was to replace the old barcode scanners and the Wi-Fi phones. So we get into the project and we realize there's more ancillary areas using Wi-Fi phones, like transport, environmental services, and respiratory therapy, and phlebotomy. So we've hit a lot of those areas, and they are now users of the TC devices that previously weren't, considered clinical users, but now have turned into clinical users because they're communicating, via secure messaging apps, and they have the directory for the hospital, loaded. And so it really has given, not only our nursing and clinical teams more functionality, but we've expanded that out into some of the ancillary areas across the hospital.
That's great. That's a telltale sign of a successful implementation, right?
Yeah,
it really is. Ricky, can you talk a little bit about, through this whole conversation, to me, it sounds like, there's, what Zebra had to offer technically, the architecture, how flexible it is. Can you talk a little bit about that?
Sure. And I kind of wanted to hit on some of the points Christina was talking about,
Sure.
kind of expanding. Because I think that folds right into it. When you were talking about there's the planning piece and then there's the governance piece. Once a device or a solution set or any type of technology actually goes into production, I mean, that's where the value starts to really be recognized. Not just in the day-to-day workings, but those of us who are technologists or individuals who have supported rollouts, you're looking for data. You want to understand how it's used, so then you can continue to build out those next steps and those lessons learned. And Mike, I chuckled a bit when you talked about gaining new friends, because really the goal is doing this right. Good news and sometimes bad news, but really good news, and especially with technology that's easing burden, good news tends to spread like wildfire. And so that good plan you set out as to what area, what departments, what hospitals will go first, you've got to kind of hold to because of that enthusiasm. And with that same thing, as you kind of asked the question on technology and infrastructure, you have to have partners who can be able to support that ebb and flow as the technology goes into production. I had a great mentor and someone I worked with process improvement years ago, and used the saying, there's work as it's designed versus work as it's actually done. It doesn't matter how many process improvements, or in this case, in the work we do every day, technology rollouts you do, there is always a learning, and the infrastructure you've designed oftentimes should meet your strategically designed use cases, but it also needs to adapt to those areas of, we hadn't quite thought of it, or these expanded roles that Christina had mentioned in her examples. And so we do the same as we're looking to design our technologies. We're thinking about the people who will use them, the workflows in which they'll be used, whether those are on the first priority, or the understanding that once your first step in technology adoption or advancement, whichever platform you're coming from, the solution set's able to support those needs, not just now, but really in the longer term. And in today's environment, where investments are becoming increasingly highly scrutinized for looking for return on investment, which is critical. It should have always been that way. We're looking and holding ourselves to that same level of accountability of having technologies that are going to serve your use cases today and be able to support the use cases in your distant future, understanding that technology is going to adapt quickly over that time. So that's really where we focus on, is the longevity of technology adoption and the multiple applications and multiple use cases in our build today, as well as supporting future use cases as well.
Well, Ricky, it sounds to me as if you've actually, you've achieved that whole concept, that goal of providing technology that establishes the opportunity to increase return on investment, right? To continue to be flexible in the architecture, and that will help them move it forward, to all their new friends within the organization. But absolutely, it's a great story. It really is. We're just about up on time, and we're always sensitive to our listeners. They generally have about 25 to 30 minutes to listen to our podcast episodes. So I want to be sensitive to that. But this has been a great discussion. But before we close, Ricky, could you just let us know? I just want to make sure. Could you let us know the website for Zebra Technologies?
Mike, that's a great question, and it is www.zebra.com here, and I appreciate the opportunity to discuss these, and a huge thank you in partnership with Christina for sharing their story.
I think it's been great. Thank you very much. And Christina, could you share MedStar's website? Because, when I'm traveling in Maryland or Virginia, Washington, D.C., if I need to see somebody, I got to know where I'm going. So
absolutely. So our website is medstarhealth.org, and we'd be happy to see you anytime. Although we don't want to see you, but we'd be happy to.
Well, I'll come in for a well visit. So,
there you go. We'll take you for a well visit.
Yeah, see, I like the well visits. Well, that wraps up our discussion today, and we hope you enjoyed it as much as we did. Stay tuned for more episodes in this podcast series, and by all means, check out our other podcasts on your favorite podcast platform. We are NJHIMSS, that's NJ Hymns on Spotify, Apple Podcasts, Google Podcasts, Amazon Music, Podbean, TuneIn, plus Alexa. Thank you all very much. And don't forget to visit our website, njhymns.org. Thank you all very much. Have a great day.